Hi, I'm Dr. Shermie Cadabona, and I'm an integrative acupuncturist here at Sutter Health's Institute for Health and Healing. I'd like to share with you some acupressure points that you may find helpful during this very challenging time. Before I get to the points, I'd like to share a little bit about how they work from a Chinese medicine perspective. So in Chinese medicine, anytime that there's a pain condition, and it's really interesting, the pain can be either physical, like neck pain or back pain, or it can be emotional, like stress and anxiety that we're all feeling during these times right now. In Chinese medicine, no matter what type of pain it is, the diagnosis is the same in Chinese medicine, and that diagnosis is qi stagnation. So when your qi or your energy is not working or flowing very well, it can cause pain, whether it's physical or emotional, sometimes both. So anyway, what these points do is to help move your qi, so it gets that flow going the way it's supposed to. So one of the ways that we've been experiencing stress and anxiety is a tightness in the chest. So our first point is called Neg Wan. It's the 6th point on the pericardium channel, or PC6 as we acupuncturists call it. This point, PC6, can help open up the chest. So the way you find this point, it's on the inner arm, and you use 3-finger breaths from the wrist crease. And so it'd be right about there in the middle of the arm there. And you can use a thumb to massage in a circular motion, or you can go back and forth along the meridian pathway. But basically just get in the neighborhood of that 3-finger breath distance from the wrist crease, and you can go to town on that. Do this for 3 to 5 minutes, and it'll help open up your chest. Just breathe normally, nice and relaxed, and you can feel a difference pretty quickly. Next is a pair of points that are commonly used in any pain condition. And as I said earlier, pain can be either physical or emotional, like with stress and anxiety. The first point of this pair is large intestine 4, or Hagu, which means Union Valley. This point is located on the hand, and if you find this metacarpal bone here, the first metacarpal bone, find the center of it. So here's one end of it at the knuckle, and here's another end of it here. You can just palpate on your hand and find it. Find the midpoint of that bone, and then go into the valley of your hand here, and that's where it is. So again, with these acupressure points, just get in the neighborhood, and you can use a thumb to make some circular massage motions here, or you can slide back and forth along that point. And this one is in general for any type of pain in the body. But when it's paired with our next point, liver 3 or Tai Chong, those two together work very well to strongly move qi and blood so that stagnation is removed. The qi can move very freely and thus alleviate pain. The point that's paired with large intestine 4 is liver 3, and it's on the foot. So on your foot, between the big toe and the second toe, find the base of the toes, and then come up a little bit toward the ankle, up the foot, and you'll fall right into a natural little dip in that space there. And you might find that that spot feels a little bit tender. That's normal if there's some issues going on with stress and anxiety and other things. But I would expect that most people will have a little bit of a tender spot here these days. So anyway, same thing as before. You can use your finger or your thumb to massage that point in a circular motion, or you just get in the neighborhood and go up and down along that meridian path. And so again, the points large intestine 4 on the hand and liver 3 on the foot work together very, very well to move chi and blood and to get everything moving so that the stress and anxiety can get cleared. The last point that I'd like to share with you is called Zusanli, or stomach 36. Zusanli means leg 3 miles, or 3 li. Li is roughly a mile. It's a measure of distance. What the name indicates is that if you use this point often, you can walk the extra 3 miles and you'll have that strength and stamina to do so, no matter what. So this point, stomach 36, Zusanli, is used as one of our go-tos for building and maintaining chi of the whole body. Also, because it's on the stomach meridian, it can help address any stomach or spleen issue, and that means digestion, nausea, bloating, GERD, anything of that nature. So stomach 36 is a very powerful and very useful point to know. Our last point, stomach 36, can be found on the leg just below the knee. So there's a couple of landmarks to be aware of. One is the eye of the knee right here, which is just below the patella on the outer side of the leg, the lateral side of the leg. So that's one landmark. And the other is the tibia, the shin bone, and more specifically the crest of the tibia, which is the highest point of that bone. So from the eye of the knee here, we're going to go 4 finger breadths down, and then about 1 finger width lateral of the tibial crest. Okay, that's a lot of anatomical jargon there, but it's pretty easy to find. So 4 fingers down from the eye of the knee and right about there. Again, you might find that this point might be a little bit tender. You may also notice that if you slide your finger somewhere in that neighborhood, you'll find a natural little dip there, and that's the point. So again, with the thumb or your finger, you can use a circular motion to massage, or just get in the neighborhood and massage back and forth along the meridian pathway, like so. So to recap, these 4 points can help alleviate the effects of stress and anxiety by moving your chi and blood and helping it flow in the manner that it was designed to do. Nice and slow and easy. Again, pericardium 6 can help open up the chest. Li 4 and liver 3 can help move chi throughout the body and help with any kind of pain in the body. And finally, stomach 36 can help with immune system, building your immune system by keeping your chi healthy, and also can address if there's any digestive symptoms that might be coming up as a result of stress and anxiety. So I hope you find these helpful, and we look forward to getting through this together. Thank you.